Aging isn't subtle. It creeps in quietly, then strikes loud, aching joints, restless nights, sluggish digestion, skin that once glowed now, looking dull and dry. For many seniors, daily discomfort has become a normal part of life. But what if a simple, time-tested remedy could challenge that norm in just 1 week? What if one change, just one, could send a ripple through your body and shift your experience of aging? Enter castor oil. Ancient, humble, often overlooked, this golden liquid might just be the wellness revival seniors never saw coming. After turning 50, your body no longer responds to stress, inflammation, or damage the way it used to. Repair slows, resilience wanes. But solutions don't always come from expensive prescriptions or high-tech procedures. Sometimes they come from the earth and have been sitting on your grandmother's shelf for generations. This article doesn't aim to romanticize castor oil. Instead, it seeks to present you with a grounded, practical, and medically informed perspective. Over the next few minutes, we'll explore how castor oil, when applied intentionally and safely, can yield powerful benefits, often within a single week of use. Backed by science, supported by real-life experiences, and shaped by years of professional work in senior healthcare, this is your guide to understanding what happens when adults over 50 introduce castor oil into their wellness routine. The goal isn't to chase youth. It's to reclaim comfort, vitality, and agency, starting with a single bottle of castor oil. Let's begin. Aging and the mounting health challenges. After 50, growing older is accompanied by visible and invisible shifts. Externally, skin loses elasticity, moisture, and tone. Internally, digestion slows, joints stiffen, inflammation rises, and sleep becomes increasingly fragmented. These changes don't come out of nowhere. They're the natural result of cellular aging, hormonal fluctuation, reduced circulation, and wear and tear on organs and tissues. For instance, according to the Centers for Disease Control and Prevention, CDC, arthritis affects nearly 50% of adults over 65, contributing to chronic pain, limited mobility, and reduced quality of life. Meanwhile, a study published in the Journal of the American Geriatric Society found that nearly 2/3 of adults over 60 struggle with at least mild sleep disturbances caused by everything from hormone changes to anxiety to physical discomfort. Unfortunately, the typical response involves piling on medications, sleep aids, laxatives, pain relievers, moisturizers, and anti-inflammatories. But this pharmaceutical layering often creates new problems: dependency, side effects, interactions, and diminishing returns. This is where castor oil enters the picture, not as a cure-all, but as a versatile, natural support tool that addresses multiple age-related issues at their root. Better sleep through natural relaxation pathways. It's estimated that up to 70% of adults over 60 report poor sleep quality. This isn't just about fewer hours, it's about shallower sleep, more awakenings, and the nagging feeling of waking up more tired than when you went to bed. While many turn to prescription or over-the-counter sleep medications, long-term use can impair memory, increase fall risk, and interfere with deep sleep stages. Castor oil offers a gentle alternative. When warmed and massaged into specific points on the body, such as the temples, neck, or soles of the feet, it taps into the parasympathetic nervous system. This part of the nervous system promotes rest and digest mode, triggering relaxation, lowering heart rate, and calming the mind. The soothing effect isn't placebo. Ricinoleic acid, the primary fatty acid in castor oil, has been studied for its ability to engage receptors associated with mood and pain regulation. In one clinical review published in the Journal of Ethnopharmacology, researchers noted that topical application of castor oil could exert mild sedative effects, potentially reducing insomnia without side effects. Real-life case Maria's restful turnaround. Maria, a 66-year-old retired nurse, had struggled with sleep for over a decade. Night after night, she lay in bed wide awake, her thoughts racing. After learning about castor oil from her daughter, she began applying it to her feet and neck nightly. By the fifth night, she reported falling asleep within 30 minutes and staying asleep until morning. No pills, no grogginess, just natural rest. Joint pain relief, a natural anti-inflammatory ally. Joint discomfort is one of the most universal complaints among older adults. Whether it's aching knees, stiff shoulders, or throbbing hands, the culprit is often inflammation, a result of aging cartilage, reduced synovial fluid, and degenerative conditions like osteoarthritis. Castor oil contains compounds that mimic anti-inflammatory medications, but without the systemic side effects. Ricinoleic acid has been shown to reduce prostaglandins, the molecules responsible for inflammation and pain. When massaged directly into joints or used as part of a warm compressed pack, castor oil can penetrate deep into tissues, soothing pain and easing stiffness. A study in therapy research observed that patients with knee osteoarthritis who use castor oil packs regularly experience statistically significant pain reduction over a short time. Real-life case, Robert's return to the garden. Robert, 71, had nearly given up his beloved garden due to hip and knee pain. After attending a wellness seminar, he tried castor oil compresses 3 times a week. By the second week, he was spending hours outdoors again. The relief wasn't miraculous, it was methodical and rooted in consistent application. Digestive ease for a slower system. Constipation becomes increasingly common with age, often due to reduced muscle tone in the intestines, lowered water intake, less mobility, or side effects from medications. When the gut slows down, everything else can feel sluggish energy, levels mood, appetite, and even sleep. Castor oil has a long history of use as a natural laxative. It works by stimulating the muscles of the intestines, a process known as peristalsis, encouraging bowel movements within a few hours. Unlike fiber supplements that require sustained hydration, castor oil acts more directly, though it must be used cautiously and only under proper guidance. In clinical studies, small doses of castor oil have shown high efficacy in resolving occasional constipation. However, long-term or overuse can lead to dependency or irritation, especially in seniors with sensitive digestive systems. Important note: for internal use, castor oil should always be cold-pressed, hexane-free, and clearly labeled as safe for ingestion. Even then, it should be taken under medical supervision, typically no more than 1 teaspoon, no more than once every few days. Hydrating aging skin. Nourishment from within, dry, cracked, and fragile skin is one of the most frustrating signs of aging, one that can lead to itching, infections, and a loss of confidence. With natural oil production declining after age 50, many turn to creams and serums filled with synthetic ingredients that offer temporary results at best. Castor oil, by contrast, provides deep hydration through natural emollient action. It's rich in fatty acids that lock in moisture, reinforce the skin barrier, and smooth rough textures. Ricinoleic acid also offers antibacterial protection, which helps prevent minor skin infections or irritations, especially common in older adults with thin skin. In a dermatological review published in the Journal of Cosmetic Science, Castor oil application improves skin elasticity and barrier function, making it a preferred ingredient in anti-aging formulations. When applied nightly to the face and neck or mixed with a carrier oil for full-body use, castor oil nourishes skin from the outside in. It doesn't just sit on the surface like a lotion. It penetrates, repairs, and restores. Improved circulation, supporting vital blood flow. One of the most underestimated aspects of aging is declining circulation. As we grow older, blood vessels become less elastic, and the heart's ability to efficiently pump blood throughout the body diminishes. This can lead to cold extremities, numbness, swelling in the lower legs, slower healing, and even increased risk of vascular disease. Massage therapy is often recommended for boosting circulation in seniors, but not everyone can afford frequent sessions. Here, castor oil becomes a cost-effective and powerful ally. When gently warmed and massaged into the legs, feet, and hands, it acts as a circulatory stimulant. The oil's thick consistency and natural warming effect enhance blood flow and promote oxygen delivery to soft tissues. Scientific findings support these benefits. A study in the Journal of Alternative and Complementary Medicine noted that individuals who use castor oil packs on the abdomen or limbs reported increased peripheral circulation and reduced inflammation markers. The process works through both mechanical stimulation via massage and biochemical action from ricinoleic acid and other beneficial compounds. This improvement isn't merely cosmetic. Enhanced circulation supports tissue repair, reduces muscle fatigue, and promotes overall vitality in older adults who may struggle with mobility or chronic pain. In clients with diabetic neuropathy, for example, improved circulation can help reduce tingling and sensitivity in the feet, an issue that often goes underreported. A cautionary note: using castor oil safely despite its natural origins and benefits. Castor oil must be used with knowledge and care, especially in older populations. What's safe for the average adult may not be appropriate for someone with pre-existing conditions or those on multiple medications. Topical use precautions. Before applying castor oil to large areas of the body, a small patch test is recommended. Apply a few drops to the inner forearm and wait 24 hours. If no redness, itching, or irritation appears, it is generally safe to proceed. Seniors with sensitive skin eczema or a history of allergic reactions should consult a dermatologist before using any new topical product, even natural ones. Internal use guidelines. Ingesting castor oil should always be done with medical supervision. Because it stimulates the bowels, improper dosing can lead to diarrhea, dehydration, or electrolyte imbalances, risks that are more serious for seniors than younger individuals. A common mistake is assuming that more oil equals more relief, but with castor oil, moderation is critical. Drug interactions and chronic conditions. Seniors taking blood thinners, diuretics, or medication for high blood pressure must be particularly cautious. Castor oil may interfere with how certain drugs are absorbed or processed. Additionally, those with gastrointestinal disorders, such as ulcers, Crohn's disease, or irritable bowel syndrome, should not use castor oil internally without clear guidance from a physician. Finally, because of its strong scent and viscosity, inhaling heated castor oil vapors in a confined space could irritate the airways in those with asthma or chronic respiratory conditions. Always ensure good ventilation and avoid direct inhalation of steam or oil vapors. Empowering real stories of change. What makes castor oil stand out isn't just the science, it's the stories. The experiences of everyday people, many of whom had resigned themselves to discomfort as an inevitable part of aging, give life to the data. Helen's radiant skin. Helen, age 74, had struggled for years with dry patches on her arms and legs. Over-the-counter lotions offered temporary relief, but the roughness always returned. On a friend's recommendation, she began applying castor oil mixed with almond oil after her showers. Within 1 week, the flaking had vanished. Her skin felt softer, less tight, and visibly healthier. She didn't just look better, she felt more confident and in control of her body. Frank's circulation breakthrough. Frank, 69, had noticed cold, tingling feet that would worsen at night. Despite wearing compression socks, the discomfort persisted. He started a nightly routine of warming castor oil and massaging it into his feet before bed. By the 7th night, he was sleeping more comfortably and no longer waking with numb toes. His physician noted a slight improvement in his capillary refill test, a subtle but meaningful sign of increased circulation. These aren't miracle transformations. They are the result of consistent, mindful self-care using a natural substance that supports rather than overwhelms the body's own healing mechanisms. The 7-day castor oil routine for seniors. For seniors interested in integrating castor oil into their daily routine, here's a simple 7-day protocol that supports safety and effectiveness. Day 1, 2, start with a skin patch test. If no irritation occurs, begin applying a small amount to feet or temples at night. Day 3 to 4, add castor oil massage to sore joints or areas with stiffness. Use circular, firm, yet gentle pressure. Day 5, if your digestion feels sluggish and your doctor approves, try a half teaspoon of food-grade castor oil on an empty stomach. Day 6, begin applying the oil to your face and neck before bed. Avoid the eye area and use a clean pillowcase. Day 7, focus on circulation by massaging oil into legs or feet, wrapping with a warm cloth if possible. Throughout the week, monitor how your body feels. Journal changes in sleep, pain, energy, skin condition, or digestion. Always err on the side of caution and consult a healthcare provider if anything unusual arises. Conclusion: a gentle yet powerful tool for aging. Gracefully aging with dignity doesn't mean accepting discomfort as the norm. It means staying curious, open, and proactive about the small tools that can make a big difference. Castor oil is not a cure for aging, but it is a bridge between traditional wisdom and modern science, between passive aging and empowered living. Its benefits are cumulative, not instant. Its action is gentle, not aggressive. But for the senior who is ready to reclaim a sense of control over their body, it can offer tremendous value. Whether you're seeking better sleep relief from aching joints, smoother skin, or a healthier digestive rhythm, castor oil may be the ally you've been overlooking. Safe, affordable, and accessible. It reminds us that not every solution needs to be synthetic or expensive. Sometimes nature's simplest gifts hold the most promise. From my professional experience working with hundreds of older adults, I can say confidently, the patients who thrive are the ones who stay engaged with their health, who try new approaches thoughtfully, and who believe that wellness is possible at any age. You don't need to change everything. You just need to start somewhere. If you found this article valuable, we invite you to join our growing community at Longevity Secret. Like the content, give us a thumbs up. Want more expert insights, real-life health strategies, and age-positive solutions? Subscribe to our YouTube channel and be the first to receive empowering content created just for you. Aging is inevitable, But how we age, that's a secret. Let's unlock it together.